Well, Senator Kuehl, this is beginning to feel like home. This is actually the third time I've been to California in this room, so I'm glad to be back. Although, you know, I've spent 20 years trying to make these events unnecessary, and I'm very appreciative for Michael. I should say right from the beginning that when you see the film this afternoon, you're going to think I'm an imposter, because when Michael's team called me about a year ago to talk to me about the film, I was actually so despondent about health care that I couldn't give an interview. So they had to use the old material. And so it was just so exciting for me to see all those nurses today. I just cannot tell you. After 20 years of trying to get people to pay attention to exactly what Michael said, and what shocked me into this, and the thing that will be the focus in the movie, is that as a young, naive physician 20 years ago, I realized that with just a flick of a pen, I could condemn a person to death, and did, all because he was expensive. And I've already seen references to the fact that that case is too old. It's a mere anecdote. I mean, all the things that came out when I testified 11 years ago before Congress. But when I testified in 1996 in May before Congress about this case, I realized just the other day as I was thinking about this, I could give exactly the same testimony again. Exactly. Word for word. I would only have to add that things have become unimaginably worse. And I think the thing that defeated me, or had begun to defeat me over the past couple of years, is that the thousands and thousands of emails that I would get from people every week, to the point where I couldn't even stand to turn my computer on. I think that we'll hear a lot about how managed care is going away. These horror stories don't occur anymore, but they do, and they occur in worse and worse forms. And I think we'll, you know, for all the humor and for all the excitement, I think that we have to remember that for me, the reason why the heart case was so important is because it's really the tip of a huge pyramid of suffering and preventable death that has occurred over 20 years, really 30 years, because the HMO Act was passed in 1973. So there's untold people whose lives have been affected by this. I think when Michael said that we can't just tinker with health policy here and there, a little piece of legislation, a little patient rights protection. It's even more fundamental than that. I think that we have created a culture which devalues life and devalues the care of other people and our care for one another. And, you know, I'm thrilled that we're here today with nurses, and I hope there are doctors here. I mean, I know there's doctors in the audience that I've already met too, but who are friends of mine, but I hope there are other doctors here who are going to represent the kind of healing and caring for medicine and their work that we need. Because I think that the thing that has almost defeated me is that we're losing the heart and soul of medicine. And that's a dangerous condition that we're going to pay dearly for, and are paying dearly for, and maybe with some of our own lives. And I read in one of the commentaries about the movie so far is that this isn't a middle-class problem. Well, not only is it a middle-class problem, you know, I ran into somebody just a couple of months ago, a businessman, a wife who's a professional. You know, they were living the American dream, big house, private school for kids, you know, everything imaginable, until one of their daughters became ill in college, and they began to lose everything. So I think that at every point, anybody who feels comfortable because they think they're protected by money or insurance or power or anything else, I think will be badly mistaken. I think the one last thing that I would like to say with regard to the movie is that I hope it expands beyond health care. I think Michael's right. We are an individualistic society that doesn't feel any responsibility for one another. And I've spent the past 20 years seeing how my healthcare is just a microcosm for the other systems, and I hope that this movie could begin to cause us to ask how we value one another in our lives and our deaths, and what kind of systems or ideologies or values do we want to have, and why do individual human stories fail to move us? The perplexing question to me still is, why did it not move people in 1996 when I, as a doctor, testified about how easy it was to cause the death of somebody, and then as I proceeded to spend 10 years trying to get people to understand what was happening. So I think this is our moment in time. I don't think we'll ever have another moment. And I'd like to end with a quote from Abraham Joshua Heschel, a theologian, who said, "Few are guilty, but all are responsible." Thank you.